I would just love to do just some appreciation for my team overall. We have just the most amazing team of people at MCAC. And I also just wanted to really highlight the work that they've been doing for the Rowena fire survivors.
Yeah.
Our team is leading the disaster case management, and we have housed 27 households now since the fire. And so that is just amazing work, because as we were talking about earlier with the housing the way that it is in a crisis, finding those 27 units was not easy.
I believe you. Yeah. Hello, my name is Robin. I'm here with Lesley on the CCCNews podcast. She's the director of Columbia Community Action Agency. Welcome to the show.
Thanks for having me, Robin.
You're so welcome. So I'd love to talk about the Gloria Center. I'd love to talk about the pallet shelter, the resource center, the Rowena fire recovery you guys are doing. Let's start with the Gloria Center. Like, it's new. You guys have only been open a year, maybe?
A year at the Gloria Center.
Wow. How's it going? Tell me what you guys are doing there.
I think it's going great. So before the Gloria Center, some people might remember that we were in a house on 4th Street, which was a very, very small office space. So the Gloria Center has really allowed us to expand our services. And we have community partners on site there who also provide services. The Gloria Center is what's known as a navigation center, which means it's kind of a one-stop shop. So when people come in, our goal is to meet all of their needs and not have them, wandering all about town trying to get things done. Mm-hmm. And the Gloria Center's open Monday through Friday from 9 to 5.
Nice. So there people could come to the Gloria Center, if I'm right, correct me if I'm wrong, and they can engage in like a couple, 3 or 4 different agencies there, right?
Yeah, we have 6 partner agencies on
6.
site. Yeah, so we have... I don't remember. We have Center for Living on site. We have Oregon Human Development Corporation, Inchiwana Housing, DHS, Bridges to Health, and the Health Council are all on site there.
Oh, wow. And you guys as well, obviously, Columbia Community
And
Action.
us too, yes.
Yeah, that's so cool. So there's really a kind of a large range of support you can access there from these different agencies, by the sounds of things.
Yes,
right?
And also, our services that are available there include utility services, housing, services for people who are houseless if they need like a warming bundle or something like that, case management. We provide a lot of services out of there. It's not just shelter, which is what I think that some people might think.
Oh, cool. So is there a shelter there as well?
Yes, we have an emergency shelter there.
Okay.
And it's the pallet shelters that were originally down, I think, off of Bargeway.
Yeah.
And then when we moved them to the Gloria Center, at that time, we didn't have the annex. And so the original plan was to do the shelter there at the Gloria Center. Mm-hmm. But then when we got the annex, we had to pivot because we didn't have funding streams to support both of them. And we wanted to support the annex because the annex represents a 259% increase in available shelter beds and shelter for families, which was something that we can't provide at the pallet shelters. So we now operate the annex, and then we operationalize those pallet shelters in times of emergency.
Oh, wow. So like when there is an emergency, you are opening it specifically for those times so that people that are not otherwise needing that, well, maybe they are, but it's when there's serious times like when there's smoke or when it's very cold or very hot, they have somewhere to go that's safe.
Yeah. So like we opened after the Rowena fire.
Okay.
The weekend after that, there was some big event in town and all of the hotels were booked up.
Oh, wow.
So we did open for that. And then we also opened this last weekend when we had that cold spell. We were open for 3 nights. And in that time, we sheltered 28 people.
Okay.
And 3 cats.
Oh, wow. That's a lot of people.
Yeah.
Yeah, that's great. That's a lot of people, right? Think about all those people sleeping outside. That's unhoused is really consequential to those people.
And we can have up to 36 people in the pallet pallet shelters there.
Okay, cool.
So we were almost full.
Yeah, it was 75, 80% there for sure. That's cool. Wow. So then you have the annex is cool as well. I've done a little work at the annex, and you guys are redoing the rooms right now as well, right?
We are, yeah.
That's
so,
cool.
So the annex has a single side and a family side, and it is consistently full. The average length of stay at the annex is only 4 months, which I think would be really surprising to people because it is consistently full. I don't think people realize that there's so much turnover.
Yeah.
But the average stay is only 4 months long.
Oh, cool.
And right now on the single side, we are transitioning 21 of those units into permanent supportive housing. So those units will have people permanently housed there. So like they'll have a lease with us.
Oh, cool.
But it's not all of the units. So the transitional part will still be there, just less rooms.
Yeah.
And then the family side is not changing at all.
Yeah, that's so cool. So you're helping those folks there, right, engage in these other places like with the housing vouchers, right, and Bridges to Health and getting people healthcare and things like that. So they come to you, and then there's this. How does that support work?
Well, another really important partner on site there is Center for Living. So they have a caseworker who works out of the annex and is there to provide those behavioral health supports because we do have quite a few folks in there who need that. And so it's just really nice that they don't have to even leave the site and they can meet with their provider. We also have One Community Health bring their mobile medical unit there as well,
cool.
which is super cool too because people don't have to leave to go get health care.
That's cool.
And Dr. Mitty is so wonderful and people just love him.
Yeah.
And we have people who, even though they've moved out of the annex, they will still come back on those mobile medical unit days and seek services there through the mobile medical unit.
Wow, that's so cool.
Yeah.
Let's take a short break and then we'll get to the resource center and some of the other things that you guys are doing.
Okay.
This episode is brought to you by CCCNews.com, the Mid-Columbia's trusted source for honest local news. We were established in 2020 during the pandemic, and we are the digital news publication dedicated to telling the stories that matter here in the Dalles, Hood River, Dufur, Wasco County, and the surrounding region. Whether you're looking for breaking local news, updates on community events, public meetings, or coverage of important local issues, CCC News brings you meaningful reporting that's relevant to your life, your family, and your neighbors. From important public safety updates to positive community insights and cultural happenings, CCC News keeps you informed of what's happening right here at home. And it's not just headlines. CCC News also publishes podcasts, features legal notices, weather, police logs, and an encyclopedic community calendar and original stories. They reflect the voice and needs of people across the gorge. And with more than 5.5 million views since launch, it's clear that folks in our community turn to CCC News for coverage they can rely on. Best of all, it's free to read online. And you can subscribe for daily or weekly updates straight to your inbox. Perfect for staying connected to local news in between episodes of this podcast. Visit CCCnews.com. That's CCCnews.com. And stay up to date with what's happening in the Mid-Columbia.
And welcome back. So tell us, you've got a new resource center as well within the Gloria Center. Tell us about what's going on there and so we can better understand it.
So the resource center is going to be once a month on Fridays.
Okay.
And it's on the last Friday of the month from 9 to 3. And depending on how things go, we might be able to do it more often. It's kind of in flux right now, but at least right now we're doing once a month.
Okay.
And the biggest reason that we wanted to do this is that it's low barrier. In a lot of our programs, because it's grant funded, there's really rigorous paperwork that people have to go through. And some people don't want to do that, which we completely understand that. But so they can come to the resource center once a month. They don't even have to give us their real name. Just put a name down, any name, so we can count how many people we helped. But then once they're there, they can take a shower, they can get laundry done, they can connect with other resources if they want to, and they can have a hot meal. And also, they can just connect with community. When we were open for the emergency shelter this last weekend, one of the things that I think people appreciated the most was just people talking to them and just hanging out with them and just having, someone to talk to is really an invaluable resource. So that's a really big part of what our staff does.
Yeah. And what a great opportunity to talk to people who are in the midst of getting other folks into housing, who are getting folks into healthcare and mental behavioral healthcare, and they're actively in those conversations.
Yeah.
You know?
And I think one thing I do want to highlight, just because I feel like there's been some confusion, is the Resource Center is only one day a month. That doesn't mean that you can't come in any other day that we're open, Monday through Friday, 9 to 5, and get services then too.
Yes.
We're still open. It's just that the Resource Center is that extra low barrier day.
Okay. It's just low barrier and big showers and food, and then like people coming out of their offices to just kind of really meet people where they're at.
Yes.
That's
exactly.
So cool. Okay, sweet.
Yeah.
I love that.
Yeah.
Oh, that's cool. I kind of want to come get some food.
Do it.
It's not you're not aimed at folks like me, but like it sounds, the community aspect sounds
we are
great,
and
right?
we are looking for volunteers.
Okay.
And a big part of being a volunteer is just being there and hanging out with people and chatting with them, doing a puzzle with them,
I love this.
playing a game, just being there and being there in your humanity with another fellow human.
That's so cool. So that's the last Friday of the month.
Last Friday of every month.
Yeah.
Tomorrow will be our first one.
Great.
Yeah.
And so that's pretty low. That's pretty easy on a volunteer basis too. Like what an easy thing to kind of try and get involved with, you know. I've volunteered across the board, and it's there's different commitments, and 6 hours a month is pretty good.
And you can sign up for a 2-hour shift, a 1-hour shift.
Oh, great. Yeah.
However you want to make that work.
Oh, cool. Fantastic. That's great. Well, folks, get into the volunteering with Macaque. That's so much fun. It's a really great team. Awesome. So in regards to the people, so let's actually quickly go to Hood River as well. So you guys serve Wasco, Sherman, and Wasco, Hood River, and Sherman. But tell me all three
counties.
So tell me what's going on in Hood River too.
Yeah, so we have an office in Hood River. It's located on State Street. And then we also have our shelter in Hood River. And so Hood River Shelter Services used to be its own standalone nonprofit, and then they merged with MCAC. And so we have the emergency shelter in Hood River that is open from November through about March every year. It kind of depends on the weather. And then that's staffed 24 hours a day, and it's open to residents of Hood River, Wasco, or Sherman counties.
Oh, wow. Okay, so there's a whole nother shelter going on over there.
Yeah.
Oh, cool.
Yeah.
Sweet. How is that one funded then?
We use grant funding for that, and then also the city of Hood River kicks in some funding for that as well, which we really appreciate.
Okay, fantastic. That's so cool. And then, so the Gloria Center, you guys do multiple different grants and things for the Gloria Center, right?
Yes, we do. Annex. Yeah, and I think people think that we're only federally funded. It's just a very small percentage of our grants that are federal. Most of our grants are through the state.
Oh, wow. Okay. Yeah. And you put that information out on one of your reports, right?
We do. It's on our annual report, or also people can go to our website at any time. We've put a lot of work into that website to keep it up to date and informative, and there's a ton of information on there. There's all kinds of data. If you go to the data page, you can read reports to your heart's content.
That's cool. Amazing. Yeah, and I remember I looked at it, you have like a pie chart, and you can see how much is coming from state, federal, and then local, and then philanthropy as well.
Yeah.
Because people are also supporting you from that basis, which is really cool.
Very appreciated.
That's so cool. Yeah. Obviously the work is really meaningful, right? And when we see donations, we see it's like a reflection of how that work is meaningful to the people that are engaging with
absolutely.
it. Right?
People are trusting us, and they are, showing that by donating funds, and we do not take that lightly. That's
really cool. Yeah, I met a couple that stayed at the annex, and they only stayed there. They were made houseless through a couple of different ways, and they'd been houseless for 10 years or more. And they came to the annex. They were able to find a spot at the annex after a little wait, I think. And then I think 3 months in, they got some support from one of your caseworkers, and eventually found a landlord that was willing to help them take the voucher that they got, that you guys supported them getting through the housing authority. actually, they got a voucher through Center for Living, actually. Well, they think they tried both and they ended up with one of those vouchers.
Yeah.
They took that and now they're living in a house for the very first time in 10 years.
Right?
Yeah. And they turned up, imagine you didn't have any furniture or anything. It was just an empty house. People showed up with beds. Like someone even gave them the first night, brought their bed, and their couple slept on the couch.
Gosh.
In their own house.
That's amazing.
It's awesome.
Yeah.
And you could see that like how much this impacted these couple, and now they're working as community health workers. So like they're coming back around full circle, really support the community that supported them.
Yeah, and those are the stories that like get me out of bed in the morning.
Yeah.
Sometimes there's really, really hard days.
Yeah.
And so those are the stories that keep you going.
For sure. It must be so hard because you can't help everybody all the time. It's so dependent on the funding and the availability of different, different resources.
Yeah.
For sure. So, it must be, it's hard for folks. Like this is a hard challenge to fix. Housing,
it is.
right?
Yeah. And I mean, it's not just us, right? Mm-hmm. Like this happens everywhere. Mm-hmm. I mean, in the US. I will have that caveat, but we're not alone in this. Yeah. And so just knowing that we have a community that does support us, it goes such a long way.
Yeah, I can see that for sure. So tell us a bit more about who we're serving here. You guys do some data, don't you, in January?
Yeah.
And what's that data showing us?
Well, we work mostly with low-income and houseless community members. I think that, the data is showing us that this need isn't going away. And depending on which report you're looking at, which program, we're serving more and more people. And, I think when we were in the pandemic, we saw there was a huge spike in the funding that was available. Mm-hmm. And then those funds dried up, but that need did not dry up. And so I think what the data tells me is just that there's still a huge need and we still have a lot of work to do. Yeah.
Yeah. There's a housing crisis in this region and we're not unique in this region by any stretch either. America slowed down building housing in the 70s and hasn't caught up with population, right?
It hasn't. Then it's so expensive to build housing, especially right now with all the tariffs are on and then they're off. And it's hard to know what's going on.
It's really hard to know, yeah. And without that reliability with cost, you can't get large investment for affordable housing projects because there's too much unknown. There's too much, too much variable. The banks and the funders don't like that those variables, right?
They do not.
They like to know what they're going to buy, But there's really are there really vulnerable populations like youth, like children and veterans and seniors in this population as well, or is it just folks my age? What's that?
No, one of the biggest growing needs is among our seniors.
Oh, wow.
We have seniors who are aging into houselessness, and we have probably the oldest population of folks at the annex that we've ever had.
Wow.
Which is so sad. Like you think about that, you live your whole life and then you want to spend your golden years hopefully being comfortable and suddenly you're not.
Yeah.
So Social Security, a lot of the people that we work with are on Social Security if they're a senior. Mm-hmm. And that used to be enough to pay your rent and to be able to get by, and it's just not anymore. A Social Security check doesn't even cover the cost of the rent.
Oh, wow. Yeah, and if you spend all of your money on one thing, you don't have any money left. Yeah. Yeah, and we hear about people, we hear these stories of folks using the last of their money to buy their medicine and then not having enough medicine and like halving the dose.
Yeah, people have to make really hard choices. Yeah. Medicine, food, being warm, clothing. I mean, I'm so thankful that I don't have to make those choices, but I have had to make those choices in the past, and I know how difficult that can be.
Yeah, it's got to be absolutely torturous for sure. Yeah. Okay. Tell us a bit more about the funding in the Dalles. So the city of the Dalles funds, you get some funding from the state and state for that running those shelter, but you also get funding from the city of Hood River. Do you get any similar funding in Wasco County for the Gloria Center or the annex or the emergency shelter or the resource center?
Not yet.
Okay.
I would welcome it. I've been in community action for a long time, most of my professional career. And when I was across the river, I was at Washington Gorge Action programs, and we were supported by all of our counties there, all of our cities. And then when I crossed the river, I found it very interesting that same support, with the exception of the city of Hood River, doesn't yet exist. I have every intention of building those relationships and getting to the point where we can receive funding from our cities and our counties, because these are their constituents. Like, this shouldn't just be my problem. This isn't just an MCAC problem. This is everybody's problem that we need to figure out together. And if you don't have the funding, it's really hard to get anything done.
Yeah, and it sounds like something they've also tried to work on in other ways. So they've been willing to spend money on that investigation of those methods and potentially implementing those in regards to like building plans in the city with the city attorney and those types of things, right? I mean, when I first started this work in 2017 in the Dalles, they were trying to do an exclusion zone. They were trying to exclude houseless people from the downtown area as a means to fix the problem, right? And it, rightly it was voted down. Steve Lawrence was the mayor at that point, and so I see them engaged in this issue, but not in a way that is clearly not in a kind of supportive of the people that are really working in the professional realm of trying to work on this problem.
Right.
Yeah.
I think there's hope. I've had some conversations with some of our members of city council, and I think that they get it. So now I just need everyone to put their money where their mouth is.
That's cool. Hopefully they'll see the writing on the wall, and that this is part of one of their responsibilities. They hold the building codes, right? They're responsible for how fast we build in lots of cases, right? They hold whether we give our industrial zone to different companies and the tax implications of those right on the people that made those decisions, right? And there's those decisions are causing inflation of the housing prices and forcing gentrification of other zones, as well. And so we're seeing this. This is the result of that, right?
Yeah, it's things are just piling on.
Yeah.
So now how are we going to fix it?
Yeah. So how are we really fixing it? And it sounds like you guys having a facility and supporting and paying, intelligent people with training to help those folks in a way that really helps them. It's not just giving them some food, which is also important and also vital, but it's putting them in a situation where they can help themselves, right?
Yes, it's moving people from poverty to thriving. I don't just want to help you enough to where now you're meeting your basic needs, right? Yeah. I want to provide everything that you need to go on and be able to thrive in all areas of your life, and then someday be able to give back. Because I think that, we have, like you mentioned before, we have people who have been in this situation and are now on the other side of it and are now putting that work back into it. And that is just such a big piece of having that lens of lived experience. When you come to the work with lived experience, it changes the way that you do everything. And I feel like the work that you do matters so much more because you know exactly what it's like to have lived that experience.
Yeah. I think that's true for almost all industry, right?
Yeah.
Even more so here, but it's true when you have a medical condition and then you go to work in that medical condition. You're like, oh yeah, this is how it feels, right? And I want to help you out because I don't want you to feel like this, right?
Yeah, I remember, and I don't want that for you.
I don't want that for you, exactly, right? Or as a musician, you record people, and then you get to your recording session. You're like, I don't want to sound like those people sound. I want to sound different. There's that professional context in so many things, and it's so valuable, right?
Yes.
This, as we know from I was lucky enough to go to college. you don't learn these things in college, right? You learn these things in experience, like in the workplace.
Yes.
And so this is such valuable experience, or in life as your,
Right.
as like work and those types of lived experiences as
Yes.
well, really drive those people to being able to deliver really good results, for sure. Because those are the people that know those problems the best.
Yes.
Industry irrespective of it.
Yeah, and that is a basic core tenet of what community action is. It's people helping other people because they have had that experience. And that's, when the funding first came through for community action in 1964, that's what it was. It was people with lived experience helping other people, because people who have lived in poverty know best how to get people out of poverty.
Nice. That's great. Well, thank you so much for coming to the podcast. I really appreciate it. Is there anything you want to leave our audience with before we close up?
Yeah, I would just love to do just some appreciation for my team overall. We have just the most amazing team of people at MCAC. And I also just wanted to really highlight the work that they've been doing for the Rowena fire survivors.
Yeah.
Our team is leading the disaster case management, and we have housed 27 households now since the fire. And so that is just amazing work, because as we were talking about earlier with the housing the way that it is in a crisis, finding those 27 units was not easy.
I believe you. Yeah.
But yeah, just so much appreciation for the team that I have at MCAC. And none of this would be possible without them. I'm just one person, who's occasionally useful, and they are the people who are useful every single day, who are doing the real work.
Amazing. That's so cool. Well, thanks so much for coming. So thanks so much for doing this really important work in community. Point people to your website, mccac.com.
Yes.
Where you can find reports of like how many people you guys are serving, where that funding is coming from, where those facilities are, how big those facilities are, like all that stuff is
all of it.
It's all in there, right?
Yes.
And there's some videos, I think, in there of some lived experience folks as well. So to encourage people to watch those.
Yeah, and they're just like 2 minutes long, and they're so uplifting.
Yeah, they're so short. So yeah, check those out. And really be great to get folks together on this. So we can work together to really keep helping people in the right way and keep lifting people up out of poverty.
Yes.
Well, thanks so much, Lesley.
Thank you, Robin.
See you soon.
See ya.